A pleasant morning to everyone. Happy Valentine's Day to all. Oh, forgive me, yesterday was Valentine's Day. But did you know that February is dedicated not only for the season of love, but also for our hearts? Today marks the celebration of the Heart Month 2021 by the Asian Cardiovascular Institute or ACBI. This is the time of the year when we celebrate health and promote awareness on cardiovascular care.
The Heart Month encourages public support and the advocacy of promoting overall wellness by taking care of our hearts and reducing our risks of cardiovascular disease. Since 1973, the proclamation declaring February as the Philippine Heart Month seeks to raise our awareness of heart disease being a serious and growing health concern among the Filipinos.
Before we begin, let me introduce myself. I am Ludon Antonio.
And I am Joyce Estrellado.
And we are your hosts for today's celebration.
Are you all excited?
We invite you to sit back and join us in the opening program of Heart Month 2021 celebration with the theme, Healthy Heart in the New Normal. A lot of activities have been prepared by ACBI for you to enjoy until the end of the week.
We are all excited to celebrate the Heart Month with the whole Asian community, including our friends and guests. For your social media posts, please use the hashtags written on your screens. To start our program, let us begin with a prayer.
If my people will humble themselves and pray, if they seek my face and humble themselves and turn from the wicked ways, I will hear from heaven and forgive their sins. I will hear from heaven and heal their land. Lord, heal our land. Father, heal our land. Hear our cry and turn our nation back to you. Lord, heal our land. Hear us, O Lord, and heal our land. Forgive our sins and heal our broken land.
Truly, we have been blessed. We are grateful that despite the challenges we faced since the past year, we have remained strong, united, and hopeful of better things to come. To inspire and give us his warmest welcome, let's hear from the President and CEO of Asian Hospital, Mr. Andres M. Lecaros Jr.
Pleasant good morning to all of you. On behalf of the Board of Directors of Asian Hospital and the whole management team, I would like to congratulate the Asian Cardiovascular Institute, the whole team from its leadership led by Dr. Lemon Valencia and to the able support of Dr. Posas, and of course our Chief Medical Officer, Dr. Jose Aquin. This year, despite the difficult 2020, nothing can stop us from celebrating the Heart Month. And for this year, with your theme of a healthy heart in the new normal, I wish all of you greater strength, greater resolve, so that we can sustain our continued commitment to the community of patients we have here in the South. I believe that the pandemic has created a huge gap in terms of our ability, everyone's ability, to really respond to the continuing and growing needs, especially for our heart patients. And every day, that's all I ask from above, that all of us, starting from me, be granted greater ability, greater capacity to be able to share love, have patience, and more understanding so that we can cope up with the challenges we face every day. They say our heart should be in the right place. I've always believed that the heart should rule over the brain because it is with love, with compassion, that a true healthcare service provider like Asian Hospital can make patients feel better as we make them well. Again, my congratulations to those who organized this whole month's activity, and I wish you all well.
Thank you, Sir Andy, for that very inspiring message and for gracing this special occasion. Moving forward with our program, I would like to introduce to you to one of the most sought-after doctors in the field of interventional cardiology. He is a specialist in internal medicine, clinical cardiology, cardiac catheterization and peripheral vascular intervention, and structural heart disease. He is currently the head of the Structural Heart Disease and Endovascular Therapy of Asian Cardiovascular Institute Center of Excellence. To give us an overview of the new trends in structural heart disease, let us all welcome Dr. Fabio Enrique Posas.
At Asian Cardiovascular Institute, we aim to improve and expand procedures that are beneficial to patients who otherwise wouldn't have many options. We have started the program for transcatheter aortic valve replacement, which basically is a way of replacing the aortic valve with catheters. It is less invasive, can even be done without general anesthesia. So therefore patients can tolerate these procedures better. We also have expanded our interventions with minimally invasive interventions designed to repair failing mitral valves with mitral clips. In the near future we would have the option for valve replacement with catheters and the treatment of failing surgical mitral valve prostheses with catheter techniques. There are many other areas where we are continue to expand, and that includes tricuspid valve therapies using catheters. Of course, the age-old management of congenital heart disease in adults using transcatheter techniques to repair and improve patients' lives. And more importantly, we also expanding our options of care by creating a hybrid repair techniques for diseases of the aortic arch, which have historically been associated with significant morbidity and mortality when done in the usual open heart techniques. This basically involves making a big surgery into smaller surgeries, therefore they're better tolerated by patients and patients recover faster. It is our aim to continue to expand treatment options and expand the introduction of new technologies into our center in order to be able to improve the outcomes of care of patients coming through our institution.
Wow! Thank you, Dr. Posas, for that informative lecture. I'm sure everyone has gained a lot of knowledge after this learning session. One of the highlights of this week's celebration is the unveiling of the new and improved Asian Cardiovascular Institute. Let's watch this quick virtual tour.
This is the Asian Cardiovascular Institute. All committed to provide high-quality, comprehensive, and value-based care. We're one of the few heart attack-ready hospitals in the country today. We have clinical pathways, established protocols, and procedures to deal with our patients' conditions. Aside from our doctors and specialists, we also have highly skilled staff, state-of-the-art facilities and equipments, established and recognized procedures, the culture of value-based care, and the collaborations that are critical to manage routine and emergency medical situations.
Our 8 centers of excellence make us champions in the care of our patients. This includes our preventive and cardiac rehabilitation centers, our general adult cardiology centers, our cardiac physiology, arrhythmia, and syncope, our cardiovascular catheterization lab, which includes our structural disease and endovascular therapy, our cardiovascular surgery centers, our diagnostic cardiology, our general pediatric cardiology and congenital heart disease center, and our recently born cardiovascular fellowship training program. These centers allow us to focus on the individual treatments and personalized needs of our patients,
so that it's convenient, safe, and easy for you.
Before we proceed, we would like to sincerely thank our sponsors.
Philips, Westman Pharmaceuticals, also Unilab and their products, Glucobest, NutriBest, and Liver Prime for supporting this event. So what will we expect from ACBI this year? To know more about this, let us all hear from the Program Director of ACBI, Dr. Ofelia Valencia.
True to our mission to provide world-class compassionate cardiovascular healthcare to every individual, we have expanded our services and renovated our facilities to provide you with the best care possible, given by our team of health experts. We will continuously implement safety protocols for our staff, patients, and guests. From our centers of excellence, you could expect the following: preventive cardiology and cardiac rehab. With the newly expanded cardiac rehab unit and acquired telemetry system, our cardiac patients can experience a rehab program with seamless monitoring using state-of-the-art technology. Cardiopulmonary exercise testing is also planned to be one of our services, and our cardiac rehab team will work with you to help you to return to your daily routine and take steps to prevent future attacks and hospitalization. Pediatric cardiology and congenital heart disease. Our experienced multidisciplinary team of pediatric cardiologists and specialists will work together in the pre-operative evaluation of these pediatric patients with congenital heart disease and assessment of fetal heart defects among pregnant women. Peripheral and vascular services. We will continue to offer a wide range of vascular ultrasound studies to help in locating blockages, abnormal signals, peripheral vascular diseases. Our highly specialized services are designed to provide comprehensive care in the diagnosis and treatment of disorders affecting the circulatory system using advanced imaging techniques and physiologic studies. Heart Failure Clinic. The Heart Failure Clinic, with its value-based packages and multidisciplinary approach, will target the comprehensive management of our heart failure patients to improve health outcomes. Cardiovascular Cath Lab. Our heart and vascular specialists will provide a wide range of minimally invasive treatments for heart and vascular diseases, including life-saving care for heart attacks. Distinguished as the first and only advanced cardiovascular facility in the South, we will strive to deliver high-quality, value-based patient care with a combination of global expertise, advanced technology, and evidence-based practice for comprehensive cardiovascular disease management.
Thank you very much, Dr. Valencia, for sharing with us these great plans. To formally end our program, let us have our amazing Chief Medical Officer, Dr. Jose M. Acuy.
Good morning, everyone. It pleases me no end to congratulate the Asian Cardiovascular Institute for mounting its first virtual Heart Month celebration. And it is actually the third time that we are celebrating Heart Month in this way. This is a very special occasion, and I'd like also to thank Dr. Rosas for delivering such an enlightened and stimulating talk on structural heart disease. My thanks also go to the indefatigable director of Asian Cardiovascular Institute, Dr. Lemon Valencia, and of course, her equally relentlessly energetic manager, Mr. Albert Hinogin, and all of the wonderful staff of the Asian Cardiovascular Institute. You should actually visit us one of these days. It is a new facility and fittingly one that this institute really deserves. So congratulations again, and thanks for a wonderful morning of learning and camaraderie. Thank you.
Thank you, Dr. Lito Acuin, for your parting remarks.
Thank you everyone for being with us in our Heart Month kickoff celebration. Please join us again tomorrow for the Healthy Heart Cook Fest, which will air via AHMC's Facebook Live at 11 a.m.
I am Dr. Joyce Estrellado,
And I am Dr. Ludon Antonio. And this has been the Asian Cardiovascular Institute's Heart Month 2021 Kickoff Celebration.